Hello everyone, I am Dr. Sunaina Pamnani, a pediatric and preventive dentist practicing at Smile Isle Dental Care, North Bangalore, Karnataka. Not all baby cavities need fillings. Would you believe if I told you that there are certain treatments which do not involve drilling your child's tooth and still can help prevent the cavities on the teeth? Not all the baby teeth cavities need fillings. Certain cavities which when detected at an early stage can also be prevented by just doing home care oral hygiene measures. By certain cavities which are very in the initial stages, something called as white spot lesions. Basically, when the enamel of your child's tooth starts showing white blotchy spots on them, that is a first sign of decay on the tooth. In this stage, the cavity has not yet begun, but it is just showing the initial signs. During this stage, your dentist may recommend certain home care oral hygiene measures which you can incorporate to prevent the teeth from getting decayed. Certain other treatment options are also available which can prevent your child from getting cavities, which are known as preventive treatments such as fluorides or sealant applications. Sealants, also known as Pitt and Fisher sealants, it is a preventive dental treatment which is provided in a dental clinic. So basically, the biting part of our tooth is never a flat surface. It has grooves and fissures on them. These grooves and fissures help us in biting, chewing and tearing the food. These grooves and fissures, these are the deeper areas of your tooth where the food may get wedged. The food which gets stuck in these deeper areas of your tooth is the one which leads to cavity formation if not cleansed immediately. In some patients, these grooves and fissures, they run much deeper compared to the other half. In patients wherein we see the grooves and the fissures are very deep and they are not self-cleansing, meaning it's not going to be very easy to get the food out of those areas, we recommend sealant application. Sealant is nothing, it is just a liquid filling material which is applied in a very thin layer on the biting surface of your molar teeth basically, and it sets immediately. So in turn, it basically makes the grooves a little more shallow and self-cleansing, and it prevents or reduces the chances of your child's tooth getting a decay. Sealant application is definitely recommended on all the molars, whether they are milk molars or permanent molars. And it is very much important and imperative that it is done at the right age before the tooth shows any signs of decay. Preventive treatments are an integral part of pediatric dental practice, and we love to provide preventive dental care because we don't want to drill your little one's teeth too soon. So there are certain measures which we can incorporate in your child's dental routine and oral routines to help them prevent from getting a cavity. Certain treatments which can be provided in a dental office are fluoride applications, sealant applications and biannual professional dental cleaning. We also take a keen interest in your child's diet. So basically, we try to understand what your child's diet is like. We ask you to form a diet diary which gives us better idea as to what kind of food items your child is eating, how much sugar intake is happening, where we can cut down. So we help you curate a diet which is specific to the needs of your child depending upon the caries risk category your child falls under. Once we study and understand the caries risk category your child is falling under, we help you curate a preventive dental plan also. Not all the patients require biannual professional dental cleanings. Some may even require it sooner depending upon how frequently they are getting the stains or plaque buildup on the tooth, or how much is the sugar intake in their diet, and so on and so forth. Fillings or crowns or any dental procedures in children are not painful as they are in adults. Reasons being, the nerve of a baby tooth or a milk tooth is not very well developed as is the nerve of your permanent or an adult tooth. There are certain treatment options which we can incorporate which help in curbing the pain entirely. Even if your child requires a dental filling or a crown, it can be managed as painlessly as possible by using certain treatment options such as laughing gas or using the cartridge system of an anesthetic in which the pain perception is quite less or diminished altogether. The dental fillings are known to be very strong and they can last as long as your child's baby tooth lasts. But in certain instances or scenarios, there are chances the filling may fracture, wherein, say, suppose for an instance, if the child has bitten on something which is very hard, like a wooden or a plastic toy, or something like a walnut shell by mistake, the dental fillings can crack. But if maintained well and if the oral hygiene measures are followed, the dental fillings can last up to the entire life of a tooth.